Good evening, Instructor Shonda Luther and class. My name is Sherry Boughton. Class is Managed Care and Contractual Services. Today's date is July 18, 2018. I'm going to talk about the Patient Protection Affordable Care Act. We're going to talk about the PPACA. It's universal coverage. It's managed care. The several bullet points. PPACA became law in 2010. President Barack Obama, pictured below, is the president who signed it into law. It brought in the grandfather clause, expansion of Medicare and Medicaid, gave better access to improved performance, quality, and access to care through the 4 amended federal laws. So, while the Patient Protection Affordable Care Act was signed into law on March 23, 2010 by then President Mr. Barack Obama, the legislative history before it began on September 17th of 2009. It was with the Service Members Home Ownership Tax Act of 2009, which was about providing first-time home purchasers a credit who were in the armed forces, which had been approved by the House of Representatives on October 8th, 2009. The Senate stepped in and deleted the provisions of the H.R. 3590, and they changed the language, which they substituted their version, which addressed healthcare reform, and named it PPACA. Under the ACA bill, 4 federal laws had amendments that directly related to managed care, and they are the Public Health Service Act, PHSA. This is a wide-ranging law in multiple places that will affect health coverage, and care. The next federal law amended is the Employee Retirement Income Security Act, ERISA. And this applies to group insurance, which is sponsored by employers and employees. Next, we have the Internal Revenue Code, IRC, and it deals with the taxation of health insurance and health plan benefits for groups, and the application of certain excise and income taxes for individuals, employers, and health insurers. And lastly, we have the Health Insurance Portability and Affordability Act, HIPAA. This law deals with security, privacy of one's protected health information, PHI, electronic transactions, set codes, and a simplification in administration. The ACA brought about major changes to managed care, such as reforming the individual and group health insurance markets, the expansion of access to health coverage in 2014, which came about through state health insurance exchanges, the modification to the electronic healthcare transactions and provisions which affect the federal tax code. It brought about the grandfathered clause health coverage, which allowed individuals and employers to keep their existing health coverage. It prohibited insurers from placing lifetime limits on the dollar value of benefits. It required health insurers and group plans who aren't grandfathered to provide coverage for preventative care and emergency services. Plus, they must allow for individuals to have access to providers and the freedom to pick any PCP, primary care physician, they want in the provider's network. Kids now are covered under their parents' health insurance until they're age 26. It used to be 21. It put restrictions on pre-existing conditions and stopped insurance from denying, charging more for them. Medicaid and Medicare were expanded so that more individuals who needed care but couldn't afford it could now obtain health coverage, which is what the ACA was all about, developing a universal coverage. So the impact, the PPACA on individuals. We're going to talk about the extensions to the healthcare coverage for the young adults, pre-existing conditions, the 4 tiers to the healthcare plans, and the expansion of Medicare, and Medicaid. One impact to individuals is the extension of young adult coverage to age 26, which allows for them to focus on school until they can purchase insurance on their own. School, get a job, things that they have to do. They don't have to worry about going out there and having health insurance, because with the ACA came into law, individuals must be insured or be penalized. Women under the PPACA are one group which has been impacted in a big way as insurers can no longer deny them coverage for pre-existing conditions such as pregnancy and cancer. This coverage has been passed to all Americans who have pre-existing conditions. Another change for women is they can choose providers and not have to worry about paying higher costs for their premiums. Now costs for insurance must be equal across the board for men and women. Before, men used to get better rates than women, but the PPACA changed that and made it equal. Insurers also must offer maternity benefits now for women. PPACA brought about the 4 tiers of health coverage to start in 2014. The 4 tiers consist of bronze, silver, gold, and platinum, what this does was give Americans more options concerning their healthcare coverage, which can depend on their interests, their budget, and medical needs. Healthcare plans must offer a minimum of 10 categories of care to their beneficiaries. Insurance companies are being held accountable across all their serving offers, which ensures that the focus stays on providing focused and reliable care and not their profits. There is improved aid for the elderly, families with low income, and young adults. The impact of the PPACA on employers, mandated health coverage, penalties, it's got to be affordable, it's got to be good value. For employers, there was no specific requirement for what level they provide health coverage to their employees, but instead, under the PPACA for employers with more than 50 employees, then there were fines they would have to pay if they did not provide the minimum coverage required. If they had a full-time employee, which is 30 hours or more hours a week, who received the subsidized insurance in the state exchange, then that employer would have to pay a monthly non-deductible tax of $2,000 for every full-time employee, and that could add up fast, that amount. Also, employers needed to make sure that the coverage they offered was considered affordable and that it provided the minimum requirement of coverage. And if an employer insurance was deemed not to be affordable and the coverage fell below the minimum standards, then that monthly non-deductible tax the employer would have to pay went up to $3,000 for each full-time employee who received care through the state exchange. So the plan must cover 60% of the total allowed cost on an actuarial basis. So employers had to at least provide the minimum coverage to their employees. Thank you.